I'm Amber. I'm a Bellarmine University nursing student, and today I'm going to demonstrate how to properly prepare medication in the med room and verify it with the MAR before administering it to the patient. So first, before I do anything, I'm going to do hand hygiene, and then I'm getting medication for patient Meredith DeWitt's. So I'm going to go to the medicine cabinet and pull out her meds. So I have Meredith DeWitt's 8133, and her record number is MR0987. So I've got the correct patient.
But that's not because first I get when you go through each individual med and then you go through the 5, right?
Okay. So her first medication that I have is cyanocobalamin, or also known as B12, and it's 1 milligram per milliliter. It is 1 milliliter that is given, so she'll receive 1 milligram intramuscularly, and it is to be given now, which is 7:30 a.m. So I'm going to go ahead and have that prepared. My next medication is clopidogrel, or Plavix, 75 milligram oral tablet. And there's only one tablet in this blister pack. The dose is 75 milligrams, which is correct. It's by mouth, and the order is to take one daily regardless of food at 0800 at 7:30. So I'm going to go ahead and give it to her now. That way I know that it's been administered. And the blister pack is still intact, and the expiration date is fine. It's not expired. So I'm going to go ahead and have that ready. And then the last medication that Ms. DeWitt will receive is her regular dose insulin. It's on a sliding scale, and it's 100 units per milliliter. And she's going to be given that subcutaneously with every meal. And the breakfast tray is about to come up, so I'm going to go ahead and have this ready for her. And her last glucose was 263, so she will receive 15 units according to the sliding scale with meals. So now I'm going to go ahead and draw everything up. I'm going to go ahead and do the insulin. I'm going to go ahead and clean the top. That way it has time to dry. I'm going to clean it in a circular motion for 15 seconds, even wiping the edges. And while I let that dry, I'm going to go ahead and clean my B12 too. Making sure that I always keep it in eyesight even if I'm drawing my insulin up, so that I know it doesn't get contaminated. I'm also going to clean this in a circular motion for about 15 seconds. I'm going to go ahead and draw her insulin. So I'm going to use the universal insulin syringe with the orange cap. Go ahead and take the cap off. And I said that she needs 15 units, so I'm going to go ahead and pull back 15 units worth of air. And now I'm going to put it into the vial, push the air in, and then I'm going to invert and draw out 15 units, making sure I don't get any air bubbles, which I didn't. Now I'm going to use the scoop method to put the cap back on. And since this is a high alert medication, I'm going to get it verified with another nurse. Hey Liz, do you mind checking this? It's for Meredith DeWitt's. Here's the vial I pulled, and her last glucose reading was 263.
Okay. So 263, she'd be getting 15 units. And I see 15 units here.
Thank you.
You're welcome.
And now I'm going to draw up her B12. And she gets 1 milliliter, and I got a 3 milliliter syringe. That was the smallest that I had in the medicine cabinet. And because B12 is a little bit thicker of a serum, I got a 22 gauge. And because of her weight and height on the chart, it's going to be given IM. I just got a 1-inch needle, 22 gauge. Using aseptic technique, I'm going to put the needle onto the syringe. So I'm going to pull out 1 milliliter worth of air. I'm going to put it in the vial, Push the air in. Now I'm gonna invert.
At 8 a.m.
1 milliliter, making sure to avoid any air bubbles. And then I'm going to use the scoop
Finally,
technique to put the safety cap back on. And I also already pre-made a label for the B12, which is Meredith DeWitt's B12 1 milliliter to be given IM at 7:30. So I'm going to go ahead and place this on there.
go ahead.
Now before I leave the bedroom, I'm going to do one final check of her medication. So I have patient Meredith DeWitt's 8/1/33 date of birth. Her record number is MR0987. First medication is vitamin B12 to be given intramuscularly, 1 milliliter, which it is to be given now at 7:30 a.m. and it's 1 milligram per milliliter. So that's the correct unit. Be given IM now, so that's the correct medication. And the correct vial, so I put that back. The next medication is clopidogrel, 75 milligrams oral tablet. 1 tablet, also known as Plavix. It's to be given by mouth, 75 milligrams. Take 1 daily regardless of food. So I'm going to go ahead and do it at the beginning of my shift at 7:30, even though it's supposed to be given at 8. That way I know it's been administered. And the blister pack is intact and it's not expired. So the final medication that I would administer would be her insulin. Her last glucose reading was 263, so I would do 15 units, and I've already had it double checked with another nurse. It's to be given subcutaneously, and she's on a sliding scale that is given with meals. And it is 100 units per milliliter. And so I've done my 5 rights of medication and medication administration, and I've drawn everything up and labeled it. So then I would go to the patient's room, but I would do one final medication administration check before I actually administer it to the patient.